Yeah, that's a generous lens that you are ascribing to that, because honestly, I was so annoyed with everyone just wanting to minimize my concern. It's not helpful to me when the way that we console people is to tell them everything's going to be fine and, just hope for the best and it's probably nothing. That wasn't useful to me. So I really, I'm not sure I was trying to protect them as much as I was just fed up.
Welcome to the New Humanities podcast from the Chess Journal, where authors of Humanities collection articles share their unique experiences and insights so that we can explore the human core of medicine more deeply together. My name is Abhishek Bhardwaj, and I'm a pulmonologist and intensivist in Orange County, California. Our guest today in our very first episode is Dr. Rana Awdish, a pulmonary and critical care physician at Henry Ford Hospital. She's a public speaker and an author of a book entitled In Shock: My Journey from Death to Recovery and the Redemptive Power of Hope. Today we discuss with her Humanities article titled A Kind of Faith, and explore how her near-death experience changed her, how she stays connected to meaning and emotions in a turbulent world, and the dark side of hope. Please stick around till the end of the show to hear the author reading their full articles in their own voice. Today I'm very lucky and fortunate to host the Humanities Sections podcast, and I'm very grateful for Dr. Rana Awdish to come and join us. Dr. Awdish, in your own words, how do you describe yourself?
My name's Rana Awdish. I'm a pulmonary and critical care physician at Henry Ford Hospital in Detroit. I work at the intersection of culture change and patient experience and professional development and narrative writing. It's a wonderful sort of intersectional identity that I really enjoy.
I love it because I think I want to be you when I grow up. That's how I look at it, because these are all the things that matter to me. And that's why I have followed your journey over the years and constantly getting inspired by you remotely, even though we have never worked together. This piece was more recent, and you have gone through a very important life event several years ago. You were very aware about your mortality based on how you opened this article, I'll be dead in 5 years. You have almost had a near-death experience. And as a physician, you see death every day, especially as a pulmonary hypertension expert and especially as a critical care doctor. How have the years changed you over the last decade?
It's changed quite a lot. I think our training conditioned me to view death as a failure, to view it as something that was preventable and full of blame. And my earliest experience of death in the operating room, where I truly felt that I had left my body and could observe everything that was happening and was at a real place of peace, that sense of fearlessness stayed with me for a number of years. I saw death differently, that it could be an escape from pain, that it could be just another way of going home, and that it wasn't something to be afraid of. It was a transition. And in some ways, of course, that feeling leaves you, and it's not as acute as it's been in the past for me. But I think it's informed in a lot of ways how I live my life, and wanting just to take advantage of all of the things that you can't do when you're dead, and living as fully in the present as possible. And that ultimately is just about gratitude for small things and noticing and close attention and indulging in the things that we love, whether it's reading or writing or podcasts. It's a special thing to be alive, and I don't take it for granted. I know I will not live as long as some people, and I know I've already lived longer than many. And so I try not to think about the what we can't know, because we can't know, and refocus my energies on the present.
Thank you for sharing that perspective. I'm sure that the near-death experience, as you highlighted, has changed you in ways, and then the way you are approaching life is so full of gratitude and so full of meaning, in a way that we just move on from day to day. I mean, the residents and med students and fellows, we literally lived week to week, rotation to rotation, and there was no concept of life. As attending, same thing. You just go through work and then see enough death and sadness in our life, but we don't internalize it in ways that should actually be giving us a pause, that maybe we should just pause and be just grateful today that I'm not the patient, and I'm grateful that I'm able to come to work and make a difference and not take this thing for granted. In fact, your book did help me several years ago when I was just working in ICU for 5 years straight. And I started to sense that feeling in the ICU that everyone is just going through work without ever acknowledging that this is a great day for us because we are making a difference and we shouldn't take this for granted. This also brings to me a different perspective, that physicians and other healthcare professionals probably look at their own life very differently. They take it for granted. Maybe it's just a defense mechanism that just move on, just keep doing what you need to do. And it ties into the pandemic sentiment that you brought up, that the collective trauma that we all went through. No one has acknowledged it, by the way. No one has said that what you have gone through as a team, as healthcare professionals, we owe to ourselves that perhaps we should pause as friends, as group, and acknowledge and share those sentiments. It comes up very frequently when I'm talking about this aspect in ICU with the nurses, with other friends and co-fellows who were part of the team. And they're like, oh, wow, that was just 2 years ago. And look at us, don't even acknowledge it, that something that drastic has happened. Do you ever talk about the pandemic and the physician's own mortality with other friends and colleagues? And how does that feel, and what discussions are about during that setting?
I think you're quite right that for most of us, it's still very recent and present, and that we haven't done a lot of healing. It's a very, I think, American convention not to have rituals to honor difficult times. I was at a funeral for my friend's mom yesterday and realized how important just the repetition of the ritual of it was a Catholic mass around her burial was for her family, because it really consecrated the feeling that they were having that she was gone. And our culture is very much one of move along to the next thing, put it behind you, and get on with it. And I think for ourselves, we have to find our own rituals. What I did in my family was we put together a little time capsule of the things that were emblematic of the pandemic to us. My son put in his mask and his visor from school. We put in hand sanitizer. We put in signs that we got from the local Girl Scout troop. And we buried it in the yard. And we said, we'll see you again in 10 years and we'll revisit it. But any small thing that can say, I am honoring what has passed. I am looking to the future with hope. But this was very real, and we have to honor that.
Well, that's a beautiful way of, I guess, immortalizing it, if that's even a word. But that's one way to remember this hard time. I only have pictures of the pandemic. Mm-hmm. One time we were doing ECMO cannulation in our very sick patients, and we came out looking like astronauts in those suits after the procedure. And then someone just took our picture. This is for you to show it to your kid, what you were doing in the pandemic. And all of us still share the hard realities of life. And during the pandemic, how it was so painful, but the families were far apart from their loved ones. I want to ask you about this part. You mentioned this wasn't worry; it was simply knowing the day when you felt that you have something with your body, but you could not pinpoint exactly what it was. Can you elaborate on that?
Yeah, this has been a process for me of re-embodiment. I think my medical training was very disembodying. It taught me to live in my mind and ignore any sensation that my body sent me about being hungry or tired or thirsty. I was just to keep going in spite of it. And in illness, my body became a difficult place to inhabit. It was scary and full of pain and uncertainty. And so I found different ways of leaving it, even in illness. And it's only really been in the last 5 years that I've consciously worked to be with the sensations that are in my body and view them not as the enemy or a threat, but as a messenger that I'm meant to invite in and listen to and see what they have to say to me. And one of my friends, who she was a patient even more than me, which I don't have a lot of friends for whom that's true, but she had been born with cystic fibrosis and had 2 double lung transplants. Her name was Tiffany Christensen. And one of the things she always said to me is that I only asked my body for what I needed. I never asked what my body needed from me. And that I really needed to learn to have reverence for my sick body and to honor the messages. And so since her death, that's something I've been really working hard to do.
I'm sorry for your loss. I'm sure that was so personal for you, knowing your friend who has gone through double lung transplant, and it's an early disease essentially. So patients with cystic fibrosis live through and live with that disease in a very difficult way. And the teaching and the learning from your friend, that's so profound. That is incredible that during the lifespan, your friend was able to impart wisdom to you and then through you to so many of us. I honestly felt like listening to you right now that I wish there was like truly an avenue, a source where people can listen and probably over time start to realize how to live with their chronic diseases. And I don't even know if something like this exists right now for our patients, but it's a beautiful way of coping and beautiful way of realizing how the mind and the body are connected in ways that you have a lot of control over how you can react to it, controlling your mind a little bit better. One other aspect that I found, it's just so poetic and beautiful, the line that you talked about, if I brought it into the light, I knew I risked damaging it. You were describing the old process of taking pictures and the film, if you expose it to light. This is beautiful. This kind of shares with me the vulnerability that we all carry around and are constantly scared that if we only see it, then maybe it will be real and we will have to face it. Can you elaborate on that aspect? Because I found that very transformative.
I think that was the closest I could come to describing how fragile the knowing was. It was something I couldn't see and I couldn't touch, but I knew was there. But if I tried to access it or share it or expose it, it would vanish. And that kind of knowing, I was taught not to trust it. I think that was another thing I had to really unwind from my medical training, was that if something couldn't be validated, then it wasn't real and it was to be disregarded, especially as a woman. And so finding a path where I could validate it for others was important. but I had to hold it as true while I did that so as not to, be unkind to myself and my own knowing. I had to venerate both science and the body.
Right. And I think you highlighted the conventional mistreatment in a way, in a very subtle way, that has happened to women through decades and, throughout medicine, that their concerns, their symptoms can often be just, dismissed by saying that it might be just in your head. Mm-hmm. And I'm glad that, there's not a lot of good stuff that comes out of social media, but for someone like me who never even knew that this was happening, because if you are not doing it deliberately, you don't think that others are doing it. So honestly, after reading a lot of these articles and seeing a shared experience by a lot of women, especially women in medicine and others who share their own experience going through their health journey, that, look, I'm an authority in this whole field and I'm telling you that something is wrong with me and you're going to discount my symptoms. Mm-hmm. May be aware that maybe there is an unconscious bias that we all carry around, and maybe we should check it and rely more on the evidence and trust the patient and their stories. One other aspect that you mentioned, when the technician was doing the ultrasound, and how the guilt on their face when they discovered something that they wish they had not. And that resonated with me so much, because when we are in our offices discussing the CT scan finding of cancers with our patients, showing them the image, and it breaks my heart every time I have to give a diagnosis of cancer to a patient who really is hoping that that's not the case. And we felt like, I'm the reason who did this to this patient today. And how do you cope up with that? And how do you go on about your day after you have given this heavy diagnosis to someone?
I've come to realize that it's true long before we speak it into being, right? It's true before we find it on the scan. And nothing changes when we find it. It's only in how we deliver the news that we can truly make a difference for the person. And I think that's why I focused so much of my efforts on communication training for myself and for my trainees, because my role is not to add unnecessary suffering to that moment. The suffering is there. I cannot control it. It is part of being alive. But in how I tell them, I can hope to be a partner to them, to mitigate some of their distress, to help them navigate it. And in truth, when I view it in that way, I can see myself as a value to the moment rather than a negative that's bringing this into the world. It's all what role we take for each other.
Right. And I think there can be a lot more that needs to be addressed and done for trainees and for physicians beyond training as well, about the communication part of it, because I think the intention is always there, but the skills probably are lacking. So some of us are more in tune with what's going on and probably are gifted in ways that perhaps we can do better with the sharing of this information. But I have had situations where the patients left their oncologist or primary care doctor's office and came back with more distress and more pain, because the way the information was delivered to them was probably not as they would have loved to. They needed a partner to hold their hand, to share with them that we are in this together. We will take care of you no matter what. You're not alone. You're scared, but we will take care of you. I know maybe 13 years ago when I was an intern, first month in ICU, I was grateful for one of my intensivists who said, look, every single family meeting, you're going to be part of it. You're going to learn, you're going to observe, you're not going to speak because you're not ready yet. But after several of those meetings, he asked me to start leading those meetings and fill in the gaps as he thought it was appropriate. But that kind of role modeling really helped me in developing a sense of value, even though it's a very scary environment for patients and families. But the training really helps, and I totally agree that more training is better. It is a procedure in a way. You mentioned in the next section, I drove myself to each procedure, not wanting to tend to others' worry or be bathed in false consolations and hope for the wrong things. Wow. I mean, how do you even start talking about this? Because it kind of shows the care that you have for your family members and friends, not burdening them with the responsibility of having to console you, while also saving yourself from the mental trauma that comes with knowing what you think you know, because you're a physician also. So it's a difficult spot, because as healthcare professionals, we almost always know the worst case scenarios.
Mm-hmm.
And if our loved ones are not in healthcare, they're always trying to help us that it's going to be okay. But I don't think it's going to be okay. How do you navigate that?
Yeah, that's a generous lens that you are ascribing to that, because honestly, I was so annoyed with everyone just wanting to minimize my concern in general every time something was happening, that this time I was just like, no, you're uninvited. Everyone's uninvited from the party. I am going to sit with my own feelings of how serious I think this is, and I don't want it to be minimized. Whatever it is, it's fine. I will deal with it. But it's not helpful to me when the way that we console people is to tell them everything's going to be fine and, just hope for the best and it's probably nothing. That wasn't useful to me. So I really, I'm not sure I was trying to protect them as much as I was just fed up.
That's actually an honest sentiment as well, because sometimes you just need a break from the reassurance, because you know the truth. That's amazing. When was the first time you thought that writing is a way of an outlet for you? Were there aspects of your early childhood, med school, residency? When did you start writing the narrative pieces?
I was a kid that loved books. I looked for myself in books, experiences that I could relate to. I esteemed writers so highly that I never saw myself in that way. I just consumed any book I could get my hands on. And really still, it's difficult for me to think of myself as a writer, just because I feel so grateful to the writers who meant something to me and who illustrated on the page with words things that I didn't have words for. And that process for me of learning to do that, of giving shape and story to things so that other people would have words for them, is incredibly meaningful to me. And the most critical part to me is to have a place that I can write that is completely blameless, like judgment-free zone of paper that I am committed that no one is ever going to see, that I can burn if I need to, that is locked away, because we all judge ourselves in real time as we're writing. I do it. Everyone I know does it. But I think of it, it's almost like, you've got a pitcher and you're trying to fill the glass, but the first half that you pour off is just terrible. It's the things that you have to get out in order to get to what you really want to say. And so having a way to do that, whatever it looks like, whether it's voice dictating so it sounds more like your own voice, whether it's writing first thing in the morning when your mind isn't in the most judgmental state at the end of the day, but letting it out so that you can go and look at it and say, yeah, most of that, whatever, but this one sentence, that's the most true thing that I feel. And that's the thing I'm going to carry forward and try to explore, and really looking at it as a process of exploration. What does that sound like? What does it feel like? How can I bring my senses into it? How can I flesh it out so that other people feel it too? How can I bring them into that moment through their senses? Because I think the best humanities writing really is a sensory experience where you don't tell people what they should feel, but you make them feel it so they know the same thing you know now because it was experiential. But to say that that takes many, many, many iterations, and it's so easy to give up on it when you look at it and think it just is worthless and that there isn't anything useful that you've written down, is very true, right? Everyone feels that way, but there's usually a thing. And if you can find a friend that you feel safe with who will read early drafts, I think that is another just golden gift.
Thanks for sharing those very powerful insights, because you're right. I have like at least 3 drafts in my folder right now that I was like, one day I'll submit it to Chess. One day maybe I'll submit it to the perspective piece of JAMA or something. But who am I to even aim to submit at these prestigious journals? I don't think I can do it. So that's a very constant sentiment that exists.
You absolutely can.
And I will tell you this, I think I've shared you with this, that there was a very profound moment almost 5 years ago that I have shared with you about my wife going through septic and hemorrhagic shock and my son being in the neonatal ICU. And all those experiences I had bottled up, I wrote them down, and I didn't have the courage to share it with the world because I was like, who cares? And no one wants to listen to this. And I wasn't ready. And I have all those experiences written down that I thought one day maybe I'll be able to share it with someone. And I found that perhaps I'm more inspired now to be willing to use some of the tools that you have described and share it, because it was helpful for me.
You bring up an important point that I left out, that you do have to be ready. My rule for myself is that I don't share anything if someone's response to it can disrupt my healing. If I'm in a place that's fragile enough that someone's saying the wrong thing about what I've written or offering a critique that feels harsh will destabilize me, then I'm not ready for it to be in the world. And I think in today's culture where everyone's live blogging their experiences constantly on social media, there's a sense that you need immediacy, and you don't. You need perspective and distance and reflection. And so time is a salve for writing. It's not a delay. It's the best possible thing.
Right. Definitely. Up until a few years ago, I won't be able to even talk about it. Without breaking down publicly, I will break down if I shared that experience with my friends and colleagues, because it was so profound for me. So putting it out there was just not even an option. So you might hear from me about my early draft.
Wonderful.
Do you have other words that you want to share with our audience based on these experiences?
You know, talking about meditation brought to mind a story of my son that I'll share with you. When he was little, if the weather was nice, we would try to eat out on the back porch. And, you know, children, they eat in 30 seconds and then they want to run around. So we would give him bubbles to play with. And one day he was blowing bubbles and he said, you know, look, you can see the wind. And really, without looking, my husband said, you can't see the wind. Don't be silly. And Walt said, no, watch the bubbles and you'll see the wind. And it was just like a dumb little kid thing, but it stayed with me because it felt like a reminder that there are these things you can watch for that are markers of undercurrents that you can't see. And those things that are visible in whatever way they are, whether they're thoughts that come into your mind or an emotion, They're trying to tell you something that's less visible, more hidden. But if you learn to watch the bubbles, you can see the wind.
Oh, that's beautiful. Thank you for sharing that. I think I just want to express my deep gratitude at this point for writing and for sharing your stories, because they make a difference in ways that you probably will never know, because not everyone gets an opportunity to talk to you and express that to you directly. But your work has changed me. It has helped me with coping mechanisms. It has made me a better physician, a better partner also for my family. And I think you will never realize the true impact of your work. So thank you for writing, and I hope you keep writing and sharing with us.
Thank you.
And now to our audience, thank you for listening. I hope you were able to connect to something that was said here. Thanks for sticking with us until the very end. To close out the show, here is Dr. Adish reading the entirety of a humanities article entitled A Kind of Faith.
A kind of faith. Wait without hope. I said to my soul, be still and wait without hope, for hope would be hope for the wrong thing. Wait without love, for love would be love of the wrong thing. There is yet faith, but the faith and the love and the hope are all in the waiting. Wait without thought, for you are not ready for thought. So the darkness shall be the light, and the stillness the dancing. T.S. Eliot, East Coker. Late one morning, in the middle of a busy pulmonary hypertension clinic, a thought appeared. The thought said, I'll be dead in 5 years. I had no objective basis for the thought. For me, I was actually quite healthy in that moment, and yet the thought arrived. The way familiar song lyrics sometimes enter your mind uninvited, or notes of music from a distant piano. 5 years, the voice insisted. The clarity of the thought stunned me, and I excused myself from the clinic room. I reflexively felt my forehead with the back of my hand, wanting to perceive what my body already knew. Probably because I was still in my white coat, I attempted to dismiss my own knowing as worry in the most paternalistic way possible. Dr. Authority me told myself, anxiety is not the same as intuition, Rena. But when I turned inward and surveyed my body like I would in a yoga class, I could find no nervous stomach, no twisting chest tightness, no tense jaw, no hurried heart or fidgeting limbs. This wasn't worry. It was simply knowing. It's difficult to know what to do with this kind of awareness, truth without proof. I thought of my best friend who had endured a psychotic break, how confidently she had shared her delusions with me because they were completely true to her. Distressing messages that came through magazines and social media. One definition of a delusion is a persistent belief despite not being supported by evidence and not being shared by others. So I decided 2 things. 1, I wouldn't tell anyone, and 2, I would gather evidence, proof that I was on the right side of sanity. The knowing at that point just felt so fragile to me, like old-fashioned film before it's been developed. If I brought it into the light, I knew I risked damaging it. I knew I needed evidence because without tangible proof that others would recognize as valid, my knowing would be relegated to just a feeling. It would be deemed silly and dismissed, cast off into the specious realm of delusions, monsters, and dreams. Like so many of us during the pandemic, busily taking care of others, I had put off much of my own self-care. I'd suppressed the messages that my body had sent me, cut my cognitive self from my feeling self. So I scheduled the overdue testing. I invited the waves of radiation and the empiric probe of the ultrasound machine to create a window, a portal between the bodily awareness and the science. I encouraged my body to reveal itself to me. As the technician narrowed the focus of her search and grew outwardly concerned and perceptibly sad, lumping her shoulders and sighing heavily, I felt sorry for her. I recognized the sentiment. I knew the singular guilt that the quote-unquote discovery of a tumor could elicit in us, as if by looking for it, we were somehow also responsible for conjuring it into being. In the face of her concern, I felt humbled by the apparent accuracy of my body's wordless warning, the discrete little packets of encoded chemical signals like musical notes that allowed me to know. Nothing I could have ever deciphered with cognition, with thought, an understanding that could only be received. There was something generous in that shared awareness, an affirmation of communion or a spirit of camaraderie. And the voice again telling me, the sick part of you is still you. It still hopes for your healing. I remember laying on the ultrasound table, comforted by the fact that the cells were now making themselves seen in other silent ways through reverberating waves of particles that I didn't fully grasp. I remember feeling that maybe my knowing wasn't so different. Maybe everything was just a kind of vibrational wave that we had to feel into with our bodies. Love and energy and knowing. Supported by evidence now, I shared the results of the imaging and scheduled the biopsies. I drove myself to each procedure, not wanting to tend to others' worry or be bathed in false consolation, hope for the wrong thing. I was actually so sure of the results that I tried to schedule the surgery before the pathologist had a chance to read the slides. I called a friend at the cancer center and told him I had cancer before anyone had told me I had cancer. He was baffled but kind and expedited the read. As we waited, I noticed everyone seemed to be holding on to hope that it was probably nothing and expecting it to be benign. But I sensed that was hope for the wrong thing. In that rigidly constrained kind of hope, I could find no room to simply experience what was true. I needed instead a vectorless hope, hope that was not dependent on any particular outcome, hope that had no object, hope simply as an orientation to the future, a capacity to be still, regardless. When we received the official confirmation and the cancer cells were finally visible to others, my husband asked, "Do you think it has spread?" I pointed at the place that vibrated with knowing and said, "It's gone this far." He hoped I was wrong, just as I knew it was true. I've had to learn to attune to and honor the signals within me. The aversion to eating fat that signals a biliary stricture developing, the fear of eating at all that far precedes the nausea of a small bowel obstruction, the subtle heaviness in my eyelids that signals impending septic shock. The cancer, though, was different. I wasn't facing some foreign invader or pathogen that was fomenting sepsis. I was facing myself. Cells within me had changed, and I sensed that by listening to them. I could help us find a way out. In the preoperative area, I was injected with a minuscule amount of radioactive substance that was then allowed time to be picked up by my lymphatic circulation. Those invisible channels that carry cancer cells away from their primary site to local lymph nodes and then off to new, more nourishing organs like livers and brains. In the operating room, they would listen to this signal to determine which lymph nodes to remove. It made me unreasonably happy that this message too was invisible and inaudible as well, unless you were intentional and used special instruments to detect the faint vibrations of the particles. I found it reassuring, even validating, that everyone agreed that this kind of wordless message could be trusted and believed, that we could make important decisions based only on that subtle vibration. After the surgery to remove the cancer and the localized lymph nodes and all the surrounding tissue, surgeons gently put me back together again. As my tissues began to settle into place and I adjusted to new incisions, wound vacs, and drains. 2 weeks later, the pathology report confirmed that the tumor had spread just as far as I had marked by pointing. That confirmation led to a subtle change in my husband's questions, as if he knew he had reason to value the answer differently. He said, "Okay, I'm ready. Now what's your body telling you? Hopefully more than 5 years." I sat very still, turning inward and listening for what message might resurface. But there was nothing. No warning words, no encoded message to be translated. No, it's just quiet now. That knowing is gone. He exhaled, and we sat in the stillness. And what I heard in that silence was a kind of faith.